during the lockdown and now with the ongoing precaution that just about all of us are taking, continuing to work from home, one has really seen a new theme emerge in the market, that of telemedicines. So let's explore this a little bit more, and we've got a very interesting guest joining in right now, Sanjay Vinayak, the CEO of Connect and Heal, joining in on the show. Sanjay, hi, good morning, good to have you on the show. Sanjay, while COVID has definitely led to the rise in demand for telemedicines, what according to you is the biggest change that COVID has brought? And do you sense that telemedicines are here to stay, and this is going to be the preferred platform for medicines even going forward?
No, thank you very much for having me on the show. I think you just rightly put it. Telemedicine has literally become ubiquitous. I think for me, the biggest change in this entire COVID scenario is the change in the way patient behavior has changed. I'm sorry, the patient behavior has changed in a big way, right, towards both primary care as well as telemedicine. And I think that's paramount for long-term sustainability of telemedicine now and later, right? I think the other big thing which to my mind has happened is the adaptability by the doctors and all caregivers, nurses, specialists, hospital staff. They are all now basically adapting to this new boon called telemedicine, right? Apart from these two, I think the government needs to basically get right credit in terms of how responsive they have been in terms of launching the telemedicine guidelines, which have been pending for such a long time. On March 25th, you saw Ministry of Health along with Niti Aayog launch the telemedicine guidelines, which basically freed up, amongst many other things, allowed doctors to do prescriptions, right, on telemedicine. And of late, the insurer essentially accepting telemedicine in their reimbursement plans is, I think, is a big boon for telemedicine as a whole. And I think from times to come, telemedicine is here to stay. There are challenges which obviously need to be overcome, but I think overall, I see a complete paradigm shift from normal brick and mortar to telemedicine.
Sure, and talk a little bit, Sanjay, more about these challenges, because, you know, much like consumer or FMCG companies, what one has also witnessed during the lockdown is the telemedicine has also been reduced to your local medicine shop, right? You WhatsApp them and you get a home delivery under your building or to your house if your building permits that. It's a very unorganized space, if I can call it that, the telemedicine structure. How is it that you're using this COVID opportunity to gain market traction from the unorganized lot?
See, I think telemedicine is a much wider term. It's just not about telepharmacy, right? So it's about telemedicine is about speaking to the patient using technology, right? Myriad of challenges, of course. I think the biggest challenge for us going forward is the lack of health data available in the country at the primary care level, and its interoperability is going to be very key across all telemedicine platforms. There are infrastructure issues. To say the least, the speed of the internet is going to be very crucial. So I think while data is now freely available, it's cheap. I think we need to build on infrastructure to make sure that telemedicine is basically delivered seamlessly. Health protocols and standards are going to be another big challenge, right? Because telemedicine is being adopted widespread, both by the patients and the caregivers. But I think one of the key challenges for the caregivers, right, whether it's a GP or a specialist, or whether it is a hospital staff, I think protocols and standards need to be followed. This is extremely important to make sure that the diagnosis is done properly and we have better health outcomes.
Sure. Okay, so that's about telemedicine. Now, reports suggest that the market pre-COVID was about $30 to $35 billion. Do you see the potential reaching $5 billion?
So I think I think there's a small correction there. It was 32 million or thereabouts. That's basically as per market sources. Yes, the telemedicine market is basically ready to do quantum jump. What we are seeing right now is obviously a reaction because there's no alternative available. But in times to come, we clearly see this market going up to $5 to $6 billion, because I think half of outpatient consultations probably are targeted to be met through telemedicine, and I think that's going to be a big jump. My personal view is that it's going to be far rapid than what people expected earlier, and I think COVID is to be thanked in some way to do that.
Okay. Now, you've also got top clients like Amazon, Siemens, Abbott, for instance. How's the corporate response been during this time?
No, I think the corporate world has always been a big proponent of use of technology in terms of not just healthcare, but across services. I think what is really heartening to see is the fact that they are essentially adopting telemedicine for employees and their families. They are allocating much higher budgets in spite of the in spite of the economic downturn. There are increased budgets for telemedicine, because I think there's a big pain point over there for employees and their families. Where do they go, right? Hospitals are closed, there is lockdown, and telemedicine is basically coming to their rescue. And I think hats off to all our corporates, not just ours, but the entire corporate world, as to how they're basically supporting their employees and their families through telemedicine.
Fair point. So tell us then, Sanjay, what are the steps that you at Connect and Heal have put in place to try and make use of the opportunity right now for telemedicine? What is it that you're doing at your end to ensure a bigger market share?
No, I think, we at Connect and Heal had started telemedicine much before the outbreak of COVID. We basically saw telemedicine coming into play in a big way, but obviously none of us anticipated the kind of quantum leap which we will all go through, right? Fortunately for us, we are much bigger than just a pure telemedicine platform. We are a complete online to offline healthcare platform with off-site clinics as well. So what we offer to the patient is a complete primary healthcare and urgent response journey. So right from the time a patient connects with us on our platform till the time he is healed, we will look after him, right? So when it comes to how we have prepared ourselves, we basically had a huge strength of self-established medical team, which is 126 plus doctors across many states, and basically we were able to offer multilingual telemedicine services to all our clients. So I think what is now extremely important for us is to support our telemedicine with offline support, because telemedicine has its limitations, right? And will continue to have its limitations. For example, in chronic diseases, there are times when you will have to have a physical examination done of a patient. And in those times, you need to back telemedicine with a very strong offline platform. And I think that's basically what we were fortunately ready with. We have now a network of 2,000 plus outpatient clinics across 14 or 15 cities. We have tie-ups with 1,800 diagnostic centers, so we can basically facilitate COVID testing at centers or for home collection, subject to, of course, municipality rules in each state. But yes, I think what is extremely important now, right, to put less pressure on the tertiary care or the hospital system is to be able to provide your entire primary health care either at your doorstep or anywhere but the hospital.
Sure. But, Sanjay, if indeed this is such a big opportunity and all of us admit that it surely is, what stops the listed larger players from coming into the market with their own telemedicine portals?
One thing which is obviously surprised us is that that every single healthcare service provider, be it a primary healthcare provider, be an ambulance provider, be a diagnostic center, and of course the hospitals, right? All of them are essentially providing telemedicine services to their patients. Now, obviously, there is nothing stopping any large player or any listed company to come and provide telemedicine services. It is seemingly easy, but I think one needs to be cognizant of the fact that telemedicine is at its very nascent stage. It is not yet a complete solution for primary healthcare. Till we have better technology, better infrastructure, Internet of IoT instruments are integrated. I think this is basically something which needs a lot of time and investment. And players like us who have a head start are obviously in a very good position to basically take advantage of the situation and forge ahead in terms of our business. I hope that answers your question.
Absolutely. Thank you so much for joining us and taking us through that.